since the beginning of the full-scale invasion. This has impact to mental health. This has impact to nutrition, as you mentioned, as well the vaccination. So we need to ensure that the comprehensive package is available. And there we have many of the partners, including UNICEF, who is ensuring that there are outreach services, there is a patronage services available to ensure that pediatric care is available. But on childcare, I think we always need to prioritize it. And it's a multiple aspects to bring in, but particularly nutrition important, important vaccination, important to support on mental health. As the winter is coming, I think many of the health facilities are getting prepared. If I look at the health facilities, and many of those I have visited, with generators, heating, because it is highly likely that it will be a similar winter ahead of us, including challenges, not only with electricity, but also with the heating. And the facilities are taking care that they are prepared, but you can always do more. What is a challenge for people is exactly the transport, availability of medicines. So how to take care of your own health, or how to ensure that you reach to the facility when it's needed. And let me bring just an example. When I was in Kherson Oblast yesterday, the road that you usually drive 1 hour, when it is rain, when it is slight snow, it takes 3 hours. And that's something that we need to keep in mind, that the transport in the wintertime is much more difficult. So it's not only the health sector, but all the infrastructure around the roads, electricity, heating, water, that also makes it more difficult to have proper care in the right time. So as in the past winter, we are assessing also now that the chronic diseases will go up. As well, we will have potentially higher numbers of deaths because of the cold and freezing. And WHO has published also specific paper on the winter preparedness and main risks ahead, taking into account very specific information, oblast by oblast in Ukraine. And that is available also in our website to look where the main risks are as we are entering the winter. And many of the facilities, finally, the last point, have been preparing for the winter. This is something that I have witnessed also in the facilities, including the primary care and hospitals, and many of them beyond health sector. We see also many of the centers of resilience where we have elderly doing a tea, charging their phone or radio to ensure that they have support available. But overall, Lisa, I think this year will not be easier than the last year.
Thank you very much. That was on that very realistic note. I think we can close. I'm looking in the room. No further questions. No further questions online. So thank you very much, Dr. Habib, for that really comprehensive analysis of what's gone before, what we're looking at in the future. You mentioned a paper on winterization. I'll ask colleagues, I know they're listening in Ukraine, to please add that to the notes, the link to that, and any other links that would be useful for the journalists listening. And on that, I'll close this press release. Thank you very much. Press conference. Anything else you'd like to add? Yeah.
Thank you, Margaret. And I ask everybody always, when we talk about Ukraine, please come to Ukraine. I think it's important that we see what is happening and how we can support. As well, from WHO side, we stay here available, and we have published in the past 6 months number of reports available on primary care financing, on health needs of people, situation across thousands of health facilities. So all the journalists and colleagues, please reach out, and the materials are available in our website. So that might be useful for your cause as well. But thank you, Margaret. Thank you all who joined. And I wish you a safe end of the year from one of the shelters in Odessa. Thank you.
Thank you, and wishing you a very safe time. Stay safe in Ukraine, Dr. Habicht.
Recording stopped.